is it a good idea to mix and match? Would you rather maybe get some of the benefits of, if you've already taken an mRNA, of getting the J&J shot, or vice versa? If you took J&J, would you rather get the cross benefits of mRNA? And I think that there are a lot of questions that people still have around this.
Yeah, Becky, I think these are the questions that the FDA is going to have to kind of thread carefully when they issue an emergency authorization, and the language, as you point out. So a couple of things are clear. If you're a Johnson & Johnson recipient, you are incredibly kind of maximally benefited from an mRNA vaccine. That much is clear. Now, the best matchup was J&J and Moderna, but keep in mind that was with a full dose of Moderna, and what Moderna has asked for in their booster is a half dose. But again, one would say that J&J to an mRNA gives you the most optimal outcome. To your question, Becky, the mix and match studies were small, only over 400 patients across the board. So we don't want to extrapolate too much from it, but I would say that the ability to have mix and match as an option is certainly something that makes it easier for me to administer vaccines. We're already getting a lot of booster confusion, and just being able to get somebody in the door when they need it. Here's where I think the real confusion is going to lie. It's that Moderna and Pfizer recipients are still going to probably be bound, Becky, by those high-risk conditions and limited to 65 and older. But as you might recall, the FDA Advisory Committee struck a pretty serious tone when they said that all J&J recipients 18 and above must get basically a second shot 2 months or later. So I think J&J recipients are in a little bit of a different category, and Moderna and Pfizer ones, if you can stick with the same one, fine. And that's what the agency is probably going to nod towards, as you mentioned, or if you need to mix and match, that's fine too. Moderna, mRNA, and J&J wasn't necessarily more beneficial, so I wouldn't necessarily go out of your way to look for that. Mm-hmm. And I still have concerns about the safety profile, just given that one dose J&J, rare occurrences in women, especially under the age of 50, with rare clots, but it would just be something to talk about. So it's really the J&J original recipients that we're discussing the benefit.
So look, we all say you want to follow the science, but the problem is there's not a lot of science to follow.
Right.
And reasonable scientists at the FDA and CDC are coming to different conclusions than reasonable science at the authorities in other countries, where they are saying you should get a booster shot, even if you're under the age of 65. Right. How do you follow the science when there's so little science and when reasonable people can walk away with different opinions based on the science they do see?
Yeah, I think look, I probably will echo what I sense are frustrations amongst public health providers, clinical people, because I do think we all do need boosters. And I think it's a question of when. Let's put aside the global supply, because I think that those are two issues, very important ones, but put aside the global equity issue, which I know comes up in the topic of boosters. To your point, Becky, the science is very clear, is Israel's data. We're even looking at UK's data. One of the reasons that we think UK had that decline in Delta and then this plateau had a lot to do with probably waning immunity in their population. So they had AstraZeneca, wasn't as effective as our mRNA vaccines, but still immunity decreases over time. So I think that for a lot of reasons, including some legal ones, we're going to follow the science around boosters. But if you'll notice, Becky, these emergency authorizations for Pfizer and what I expect will come out from Moderna and J&J give doctors like me an incredible amount of flexibility. They're not bound by a rigid set of conditions in people ages 18 to 64. So I do think that people can have, in fact, obesity, for example, is one of those conditions. So I do think there's some flexibility and latitude for people of all ages above 18 to talk to their doctors, especially if they're concerned, especially as we're going into household Thanksgivings and Christmas and holidays, where you might have that immunocompromised adult in your household, making a conversation about your booster very relevant for their health.
Doctor, two questions for you. One is just to put a fine point on the mix and match program that you're talking about, because we've been having this conversation in the 6 o'clock hour and then, of course, earlier in the 7 o'clock hour. The idea is that if you've taken the J&J, the one-shot J&J, clearly you need to be taking, it seems like, either Pfizer or, even better yet, Moderna, right, based on the data. But just to clarify, those who have already taken Pfizer or Moderna, when they think about the booster, you would not be taking necessarily a J&J booster.
Right. And there are several reasons for that, Andrew. Just number one, I do think that if you look at the data, you will see that, especially, for example, Moderna recipients, if you started with Moderna, it's still incredibly effective to stick with that mRNA category. And with that Moderna and Pfizer set that did have the J&J shot, I'm just bringing up the fact that we didn't have enough in that population, and it wasn't powered to necessarily look for some of the safety signals. They didn't see anything concerning, but small population. And I don't want to go back to kind of those dark days of J&J and those initial weeks, but when we had the pause and we started to see the clinical guidance around J&J to warn people, especially about the risk, those risks still apply in a booster setting. So those are all reasons that I would mRNA, stick with the category. J&J, I would advocate mRNA.